Okay, we are going to go ahead and get started right on time at 1:45 Central Time so that we have as much time as possible for the topic. Welcome everybody to the session about identifying rural EMS needs and action planning. I'm just going to tell you a couple quick things and then turn it over to Terry to tell you another couple quick things, and then we'll be on our way. So all sessions are being recorded. If you're having technical difficulties, please utilize the chat feature and I will help you. We encourage your questions and interaction with the presenters. For questions during this breakout session, you may type a question by using the chat or verbally ask your question. To ask a question verbally, click on the icon labeled participants at the bottom center of your computer screen. At the bottom of the window on the right side of the screen, you can click the button labeled raise hand. The moderator will then call on you to ask your question, which you can do by unmuting your microphone. When you're finished speaking, please remember to mute your audio to avoid background noise. Terry?
Okay, and I'm going to keep this brief as well. So these are our learning objectives. We're going to recognize the attributes of successful rural ambulance service resource as a tool for assessing service level operational status. We're going to explain the ways flex programs are using the resource to identify needs and create action plans. And we're going to interpret how other state flex programs might apply the resources to their own work. So again, I'm going to keep these bios very brief. Andrea Abbas is the EMS program manager for the Michigan Center for Rural Health. And she's got a huge background. She's a paramedic, etc. Britton Herbert is with the South Carolina Office of Rural Health and currently serves as the program manager for the Health System Innovation Team. Tim Wilson is the program director for the Office of Emergency Health Systems within the Nebraska Department of Health and Human Services. And our panel facilitator is John Eich, who directs the Wisconsin Office of Rural Health. So forgive me for the brief introductions, but that gives us more to learn in the session. So John, I'm going to turn it over to you.
That's great. Thank you, Terry. And yes, that was my fault because we've got so much great content for you today. I really wanted us to have time for that. And as such, I'm going to try and be very brief in my introductory bit. So that is, I've been asked to briefly describe the attributes resource. So this was an attempt. Our office invited folks from around the nation, experts in EMS, to come up with what they viewed as the key attributes of a successful rural ambulance service. And they did so. And then not only did we come up with those, I think it's 19 attributes, but for each one, for services to rate themselves from a 1 to a 5, we assigned some characteristics of that. So you wouldn't say, well, it's about a, let's call it a 3. You would say, oh, well, since we're doing X, Y, and Z, I guess we're at a 3. If we were just doing X and Y, we'd be a 2. The nice thing about that is not only does it kind of get us all on the same page so we can compare apples to apples, it also gives us a roadmap. So if I am at a 2, my service is at a 2, I can clearly see what is next on the list, what it would take to get to a 3, 4, and 5. So without doing anything else, we've in a sense kind of given them a roadmap to 5s in all of that. And so that attribute, that resource, that assessment was released nationally free of charge. Everyone and anyone can use it, and these super smart states adopted it and started utilizing it. And it should be said that there are other assessments, some of them much more comprehensive, some extraordinarily comprehensive. And I should also just want to point out that that was one of the reasons we made it as brief as we did, thinking that people might be more inclined to answer it if it was only 19 questions. But there is something to be gained by asking many more as well. All right, so we got some superstars here. I'll just start out with the Wisconsin experience, how we utilized it. We sent out this survey as an electronic survey 3 times, 2 years in a row, and then waited a couple of years and came back for the 3rd. At this point, it feels like we have a good amount of data, and people are getting surveyed so much, we're starting to back away a little bit on the frequency of it. We also asked people to identify which service they were at so that we could and ask a few demographic questions so that we knew that they were, say, a volunteer-based service versus paid service, et cetera. We could, because we knew where they were, we could identify them by region, by geography, by rurality. We even, because we're crazy like that, we created a new rural definition because we needed a sub-county definition because a lot of EMS services are smaller than a county. So that we could say this service is rural, this service is micropolitan, et cetera. We use this assessment to target our technical assistants in our FLEX program, the EMS programming. So we use it to target those below a certain sort of score in our programming. We then later created a workbook. We invited another expert to create a workbook, how to get from a 1 to a 5 and all the attributes. And we've released that on the website as well for anyone to use. And then finally, many of you are probably familiar with the EMS Leadership Course, excellent course out of Minnesota. We did it for many years, but what we found out when we did this assessment was that actually, I know it's not entirely linear, but if you can imagine it as a staircase, if you get to the leadership level, there's some sort of operations and management level that sets you up for leadership that we felt was not getting addressed as tightly as needed. And that's where a lot of our rural services were suffering, were in these operations and management type of issues. And so we again we asked some of our Wisconsin experts to create a class on that. And they use this assessment as their pre and post test to see if things have changed after the class, but also 6 months after the class. And so a lot of our operations are sort of centered around this assessment as the starting spot. So that's Wisconsin's story. I'd like you to hear from the others though. So Andrea, shall I ask you to pick on you first?
Sure, yeah, thank you, John. So I am the EMS Programs Manager in Michigan, and we have been using our FLEX for EMS leadership training as well. So John, you kind of stole my thunder there a little bit. So I'm going to tag off John with that. What we did, and I agree, there were some operational kind of gaps there that we also saw. So when we worked with Safe Tech on the Leadership Academy, one of the great things that we could do as an office is use this as a TA piece. So we would go through the academy and, for example, we would address storytelling, and storytelling we know is just a deeper level of looking at public education, for example, and telling your story in public to potentially get funding. So after the academy is over, this is a resource that I will reach out as an office and say, this is a resource, we're available for TA and consulting. And I have had previous attendees and others from outside reach out to me personally as the EMS Programs Manager to come in and help with a project. So then we take those 18 attributes and we discuss, okay, what area are you feeling weakness? They review it. And then we used it kind of in an unorthodox way. So we actually, like, for example, I did a quality assurance project with a small rural agency and we built out some things for them. And so we really honed in on just that section of the attributes and then started working our way that direction. The work group is an incredible resource, not only for someone providing TA and consulting, but also the person receiving it, because they can get that workbook as well and read through it and understand what's going to be happening. And so they have a head start. So we really enjoyed using the 18 attributes in this way. I think it pairs nicely with diving deep at the core of leadership and then bringing folks out of the academy and using this as a TA resource as an office saying, hey, come to us. The other use that I'm currently looking at for the next year is we're going to do a leadership network that we're already in development with, and then using these 18 attributes as discussion points, education, and TA. The other thing that I want to quickly highlight that we used your incredible attributes for as our office is we reached out to your office, and I believe I connected mainly with Penny. But what we did is we loved the way you ranked your questions, and we did a quality improvement survey statewide in Michigan, not last year, but the year prior. And we used your formatting and your template and how you set up your survey. And that was a really great resource for us. The last thing that I just want to briefly mention is the resources. We put it up on a resources page for folks to captivate. And I've also included it in the newsletter as something that we communicate out, like, hey, you can take a look at these. So we feel like we've really benefited from this incredible resource. And that's just kind of a brief overview of how we used it. So thank you.
That's awesome. Wonderful stuff that you guys are doing there. So exciting to hear about this. All right, and next, let's go with Britton from South Carolina.
All right, hi everyone. So the South Carolina Office of Rural Health has utilized the attributes of successful rural EMS agency for several years now, and we recently expanded our efforts with it. So for quick reference, in South Carolina, every one of our 46 counties is responsible for providing or contracting out their emergency services for their county. So with that in mind, several years ago, we started conducting in-person interviews with the EMS agency leadership whose services operate within counties that have a critical access hospital. During these interviews, we walk through the attribute survey question by question, and we see where each agency stands, what they immediately know they might be having difficulties with, what new or continuing initiatives they may have, which they're working to expand or grow in any of the areas that are detailed in it. We sit with our physical copy of the questions and have a guided discussion really about their agency through this system. We do this each year, and after we have a meeting with all of the CAWs, County EMS agencies, we develop a report. Each report is specific to the individual agency and consists of really three main features. The first is a comparison of their answers from this year to previous years, provides us some tracking over time to see how they may rise or potentially fall in certain areas based on prior initiatives that we've worked with or changes within the agency itself. The second feature is a blinded result of the other counties on each question to see where they fell amongst their peers, really providing us the benchmarking for the peer-to-peer comparison. And the final aspect of the report is a recommendation section on areas which could be improved. These stem from our discussions during the interviews on reasonable areas of opportunity to grow, and also where the data showed they might need some improvement. The recommendations come directly from that complimentary workbook resource. We only include parts that are specific to the agency areas identified and focus on their very next steps. How do we advance you just one tier? The agency isn't going to turn into a massive fitness center by tomorrow, but it can certainly start looking at having some healthier nutritional options during meetings. So we really just take it one tier at a time. After receiving the reports and taking some time to review, we follow up with the EMS agencies to ensure they understood the recommendations, ensure that the next step goals still seem reasonable as we progress through the year, and see just what general support we might be able to provide. So I want to add on that we recently expanded our approach. I mentioned we do this with our County EMS agencies. Well, in South Carolina, we only have 4 critical access hospitals. So the level of individualized support we can provide is very high with each of these agencies. However, when it comes to peer benchmarking, the sample count is pretty low. So we adapted the attributes questions into a SurveyMonkey, which we've begun to provide to all county contract holding EMS agencies. This will take our assessment from the 4 out to our 46 counties and almost as many agencies. We're excited for this expansion and the new data we expect it'll bring in. Be able to we're currently looking at how to best sort and arrange the data to really display what we're looking for with our state EMS agencies. It's going to provide some really great insight into rural versus urban, regional comparisons, size of agencies, more and more. So we're really excited about that in our state. With that, I'll stop.
Well, that's very interesting. And how nice that you all have been able to do that individualized approach. I mean, ours is just such a shotgun, given that we have about 400 services that are considered rural. And so it's much more of a big picture, but how cool to be able to dive so deep. All right, so thank you. And next up, Tim Wilson from Nebraska.
Good afternoon, everyone. I am the program director for the Office of Emergency Health Systems. We are fortunate enough to get funding from our Flex program here within the state. We've approached the tool in probably a little bit different of a manner, probably more the same way as John has. We currently have 427 licensed EMS services in the state of Nebraska. So for us to do those yearly benchmarks and that type of thing is going to be very difficult for us as well. So we've kind of done this in a two-pronged approach. The first time that we did the assessment, we have done this as a statewide assessment. So we went, sent it to all of our agencies, had a very good response rate. And when our responses got back, John and his team did an evaluation for us and gave us some responses. So the way that we took that individual piece that first time is looked at the assessment, evaluated it internally, and had really kind of drove some of the directions that our EMS program, my EMS specialists were taking in their way to approaching the services and providing technical assistance to services. Something quick and easy that we could do from our perspective, that where they were already engaged with the services, it didn't take any money on their part, on our part, to kind of help them out. We also took that assessment and we've made it available to our board, and our assessments are available for public use as well. But we took it to the Board of Emergency Medical Services, and in part based off of that assessment, we were able to identify where some of our pinch points were within the EMS system globally. So that kind of has allowed the board to strategically plan direction for themselves to take an approach how to better serve EMS services within the state, look whether it's going to be regulatory or statutory changes, whether it's going to be initiatives or changes in protocol, or what they need to focus on. For instance, one of our weak points was staffing volunteers within rural Nebraska. So that's an initiative that we are continuing to work on even after that assessment, which happened actually in 2016. So we continue to do that. And what that really led us to is, after that initial assessment, and about 3 years after that, we took the work from that and the work that we have done and did a more in-depth study assessment on certain points that we drew out of that assessment. So we did a statewide, basically retention and workforce study. We also went through and looked at our educational system for EMS and did kind of how we're doing from that education standpoint. And then we did survey people who refuse or have chosen not to renew their licenses over the course of the past 5 years from 2019 to figure out why did they leave, why are they leaving EMS, and what are things that we can try to help fix for that. So we've actually we're able to narrow down our focus and start on really big pitch points in Nebraska for us. The second way that we've utilized this assessment is we have gone down to the EMS service level as well. So with our flex funding, we will bring in a consultant and have them do an evaluation, an in-depth evaluation of the service. The only requirements that we have for that is when they need to request it, and 2, leadership needs to be on board. So we do have that component when they come in. When that consulting group comes in to do that assessment, we ask that they kind of do a modified version of the attribute survey. So that way we're not using the tool exactly how it stands, but we're getting pretty much the same information that's included in that attribute survey. So then it's included in the report that the service gets and that we get, as well as their leadership and other stakeholders have access to. With that, what we're hoping is that assessment also comes with recommendations and things of that nature that the service themselves can work on And what our hopes are with that is we can slowly start getting the services to go from those 1s and 2s and start moving them up as well. We initially, with our assessments, when we're doing that, we would stop basically at that point. So they would come in, they would get the results, and then the next bit, the remaining portion of them, what do I do now with them, was really up to the service component. So when we reviewed our past assessments, really that was not happening. The service either had additional questions or didn't know how to implement some of the recommendations that they had. So when we rebid our contracts, we now have it as a requirement that we'll do a follow-up with the services to see where they stand after the assessment takes place. I believe it's either 6 months or 6 months and a year. And then if they need to have additional support, we will have that consulting group come back for an additional visit or two to help provide them some of the support that they need to help transition them through some phases or help them work on telling their story or things of that nature. We also have leveraged the leadership academies as well. One of the things that trying to couple this with leadership that we're kind of noticing is with our leadership, we're running into the same things that I think John touched on, the operational and maybe the leadership issues. They really need to be addressed. And with those leadership, when we're starting to bring in leadership, with whether it be with this assessment or with our leadership courses, we started asking the question, are we bringing in the right leadership? We're bringing in the leadership of the services, which is great because they need to learn how to manage and adhere to regulations and lead their organizations into the future. But they also are owned by city, county, private entity, whatever the case is. And for a lot of those services, we're missing that city or county buy-in or knowledge level from that overarching upper management leadership level. So that's something that we've recently decided that we want to start looking on. We haven't taken any action on that, but our next steps is how do we engage leadership above the leadership that we have within our EMS services. So that's where we would like to start targeting after ours. So that's kind of a brief overview of where we have started and kind of where we're at.
That's very interesting. Two of my takeaways were, I like how you all are going to who is outside of EMS that impacts EMS that needs this information, as well as you're utilizing this survey, this assessment to dive deeper into certain aspects of it. Very interesting. So a couple of comments. I just wanted to let you all know that I put a link to the tool in the chat, so you can click on it there, and there will be those. There are several of these sort of resources there. Also, I wanted to mention that something that, and I think it was several of you sort of talked about taking this to a consulting level, and I think that's really where it gets impactful, is if you can sit down with a service. And I know that we were lucky enough to get some of the federal COVID equity money related to rural, and we decided to put it into an EMS coordinator, since we don't have a paramedic on staff, Andrea, jealous. But, and so we're going to bring someone on who will do what we've done is we've contracted with our QI agency, who hired a very experienced EMS provider to sit down with 6 services a year and just, sit at the station table and open up the books and just be like, all right, let's talk about this. And you can use the assessment, you can step off of it, etc. And so I think that I'm excited to hear that several of you are doing that as well. And we're following in your footsteps there. Another thought I had was that perhaps what we could do with the Flex program is utilize some of our funding for services who've done the assessment to do process improvement work, related to the factors where they are have shown that where they like to strengthen. So just occurred to me, I think it was as Tim was talking. So just a thought about that. So now it is 2:10. We have 15 minutes left. Looks like there's a question in the chat from Rochelle. Hey, Rochelle. Has anyone implementing the assessments implemented one section at a time for action steps to follow up versus doing the whole thing at once? And I'll leave that for you all.
Yeah, I would say yes for me, and that's the consulting piece. Is I don't necessarily just take one question though. When I sit down with somebody, we have that discussion, and then it usually leads me to that question, and then we dissect that out and we work through the steps together to make them successful. So in a nutshell, yes, kind of.
Any others?
Yeah, I would agree with that. We when we send our action plan steps afterwards, it's usually not necessarily just one section at a time, but it's kind of picked between the various sections of what might be a top criteria there for them to work on, and we go about it that way.
Nice.
We haven't implemented just like the one section at a time or question at a time. Really what we were looking at revamping our EMS program to maybe start incorporating that when we assisted our services. So that way we can do those targeted approaches. And then as soon as we were trying to revamp that and tie it in with our inspection process to kind of calm the inspection, but also give them technical assistance with that inspection. So they didn't feel like the state's in here to find something, more of we're coming in to try to help. But then as soon as we started to implement, COVID hit. So that kind of changed all of our courses at that point. And we just haven't been able to implement something at this point.
Nice. Yeah, thanks all. And so I want to encourage everyone listening, participating to please put questions in the chat so that we can get to those, because we'd love to hear your questions for this esteemed panel. In the meantime, I wanted a couple of questions that occurred to me as you all were talking. Did you survey non-rural services? I'll say in Wisconsin, we surveyed every service in the state just so we could do a comparison of urban versus rural. But do you all have any experience of that or make those decisions?
We did. When we did our surveys, we will break it out by rural versus urban. We break it down by volunteer versus paid. And then we also break it down by both our EMS regions as well as our trauma regions. So that way we can kind of pick and choose how we want to slice and dice that data, and if we start noticing areas that we need to focus on.
Right. And I think part of this, what you're seeing on this panel are the different types of state offices. Tim in Nebraska is coming from state government, so they can roll that puppy out, and then people have to do it. We've got two nonprofit models here in South Carolina and Michigan, and then our office is university based. So for our types, we have to beg, plead, and cajole for folks to do it. And that reminds me of a second question from Rochelle about response rates. The first time we did it, had a very good response rate. I forget what it was. I'm sorry, I should have done that, 75, 80%. But we saw a steep decline after that, which was part of the reason we bumped it to every other year. And then now are even waiting more than every other year. But the rest of you, how were your response rates?
When we went out and interviewed our 4K EMS agencies, we had 100%. As we've shifted to sending out to both urban and rural, just all of our county contract holders, we partnered with the EMS Association in our state. We work a lot with them, and they currently have been going through a lot of assessments around available workforce and training opportunities. So we kind of just slipped ours in with that as one. So we had pretty good response rates as well. So partnership was key on that.
Yeah. So we'll consider that a best practice for response rates. Knock on their front door in person.
Andrea,
John Noakes
So-
has his hand physically up.
What's
Oh, I
that?
see him.
John Noakes in Washington has a question. He's physically raising his hand.
Okay.
My hand up feature doesn't work on mine for some reason, and it never has. I'll figure that out at some point. So we're working on a similar project, and I picked on Andrea yesterday too, because I have a different group of panelists here. One thing I'd like to comment about Rochelle's stuff there about implementing it in one section at a time. One of the things I found with the attributes and how we're implementing them in our state is that really a lot of them have a certain level of overlap. You know, so if you're working on one section or you have a subject matter expert come in and talk about one specific section, really it affects 2 or 3 or even in some cases 4 different attributes at the same time. So I'm not saying you couldn't hit them one at a time, but that'd be a little more challenging as a group project unless you're working one-on-one directly with an agency. But kind of my question I picked on Andrea yesterday, and again, we've got a different group of panels here today, is one of the challenges I've run into with us implementing it is we did the survey. We had an 83% response out of roughly 500 agencies. So we had a good response, and that was prior to funding. That was how we got into our Flex grant. The agencies that selected obviously are most vulnerable. So these are the smallest of the small, where they have very low members that can even participate in this type of work. Has anybody experienced that within your agencies, and what have you done to help implement that? I mean, we've got one agency that lives on an island. There's 200 people. They run 20 calls a year total on a busy year. And, you know, they have 3 or 4 responders or 5 responders. And how do you get engagements from those groups, and how do you help implement these projects if they don't have the infrastructure to do it?
Panel, let you guys start.
Yeah, so they can sympathize with that with some of the rural agencies, and I think that's where it comes down to the bite-sized chunk that the workbook especially offers, where you can there is something in the workbook, I'm sure, that they can reasonably attain, and it's just finding those that there's a needs section in, and that just one level up is something they can manage, and focusing on that, even if it's just the small wins at first, that can go a long way.
Yeah, and I would jump off of that just to say that I think the nice aspect again of that sort of roadmap of 1 through 5 is it gives you a sense of accomplishment. As Britton says, you can take one question and move up one number through just adopting a few pieces. But not to interrupt, Andrea or Tim?
I was just going to highlight, I mean, and some of these are probably very obvious to you, John, so forgive me if I'm just highlighting some things you probably have already thought of, but going to them, you know, making sure that you're minimizing their travel and all that good stuff, looking for alternative ways for funding and getting really, really creative. I was discussing today, someone is looking for an ambulance and they don't have the funding for it. And instead of just going and trying to seek the funding or waiting for a grant, you know, we have a lot of large corporate entities that retire their old ambulances and donate them. So, you know, thinking of those things where you could reach out and get something like that, but, you know, minimizing travel, going to them, innovating, and yeah, the small bites, just one small bite at a time. But being a support system, really gaining that trust and that relationship, I think is key. So they can call on you and be transparent when they hit a roadblock.
Nice. And I would, oh, go ahead, Tim.
That was John. I was just gonna say thank you for the feedback, and yeah, all of our stuff's been virtual, and I provide a ton of TA to all of our agencies, and we have regular monthly meetings, plus I'm available at any time. So I'm just kind of looking for that bigger feedback group, and I did message you back, so hopefully we get to meet sometime next week, Andrea. Thank you.
That's awesome. I was going to say too that I think one of the ways our office tried to work on that is, again, this new person, we're going to start a helpline, you know, 1-800 God help us, you know, for small services, especially that are really struggling. And that will be personed by this EMS coordinator, both phone, email, and then choosing several of those each year to go and do site visits, drive up there, sit down at the table again, and like they did in South Carolina, and just walk through it and say, all right, so show me where the friction is and how we can help. Just to find any way that we can help them with whatever answers there are. There aren't many, but we can do what we can with that. And then there's a question from Tricia, and I think, Rochelle, I spoke to your question in chat, but Tricia, within the rural services, do any of you have uncertified services? And if so, how did you perform an assessment of them?
So John, I would say that, well, we don't have any uncertified, so we wouldn't include those. Any service within the state has to be licensed within the state of Nebraska in order to operate. So we wouldn't have that. I would say in addition to with the prior question, it turned out for one of our services, it was really in trouble, kind of the same situation that John had given as well. It was a lot of work on our part as well as their part. So it was 5 hours away here from Lincoln, so quite a big drive for us to go up there in a different time zone. So we were going up there quite a few times with meeting. We had 2 public meetings. We had meeting with the service and stakeholders. I met with the county commissioners, both in person, on the phone, and virtually several times over the course of 3 years. The service is about 60 miles away from the hospital, and looking at working with hospital, and they have hospital-based service and maybe trying to merge them together. So meeting with hospital administration a few times. So really just trying to see, what can we do to be an advocate for them, and also relay some information to those other stakeholders so they get the full scope of what's really happening, and not just getting it from this volunteer that's trying to protect their service too. So, and I think that helped us. It eventually got us to a solution. And some of our conversations had to be the tough conversations of, is being a BLS transport service still appropriate for you? Or do we need to look at an alternative care, alternative model for you, and look at simultaneous paging, or that you're a non-transport service, or some of those hard discussions as well as what we took. There was a question about, did we administer this the assessment internally? Or have the state EMS. And so as state EMS, we actually administered it. And we also contracted with some of John's team and Penny, who was just awesome, to help with that. So she did a lot of automatic reminders, and then we would get an update from them, I think every 2 or 3 days, on services that didn't respond to the assessment. And I would have my EMS specialist just pick up the phone and call the services that didn't respond. And I think they just got tired of us harassing them. So, and we did get a 65%, which I thought was pretty good for us as well.
It is. Thank you all. So we've got 2 more minutes. I just wanted to mention, so Jill from Arizona makes the comment that they utilize public health students to create and administer assessments. And if you have a connection to a university, students are often looking for internships. So great suggestion there. Last 2 minutes, any final thoughts from you all? Lightning thoughts?
I'll throw in real quick a kind of side benefit we happened to find previously was in a new EMS director providing this to them, especially if we've already had the results from their agency. If for whatever reason they weren't able to have that communication with the previous director, it kind of gives them a great insight as to where the agency was and some key areas to really think about as they move forward in their position.
Nice. All right, well, thanks to everyone. Thanks to these 3, especially rock stars, for coming in and telling us about their experience and what the great things they're doing in their states for EMS. And I appreciate you all for joining us. And hopefully we'll talk more about rural EMS at future meetings.
Thanks, John. And thank you, Britton, Tim, and Andrea, for joining us. Fantastic information. So we have a quick 15-minute break. We will reconvene at 2:40 p.m. Central Time for a facilitated discussion on technical assistance strategies to support value-based care as a state flex program. A clickable link to that small group discussion is made available in the chat. If at any time you need to step away or lose connection, please note you can always return to the attendee hub to access the live sessions at any time. Thanks.
Thanks, Nicole.
Thanks.